Guys, I've decided to make another video because this dog ran into my garden. How rude. And I had to cancel it off because they were looking at my gun out. But this video is all about my nose and what's happening. Just stuff like that really. But I thought I'd make this video just in case like anyone else is going to go through it. And I can let them know what actually happens and stuff like that, so and actually talk about the surgery. There's not many, I don't know if there's any YouTube videos about it, but I don't know. But yeah, I'm having my nose done, but it's not like outside, it's not cosmetics, that's if no one knows about it on here. I've already made a video, but that were even before I even went to hospital and had a consultant. And if you don't know already, my nose just inside on my left hand side is like bent. It's like that, so it's blocking. So bit, you're looking at me. It's like blocking me to breathe, so I don't get much oxygen in my blood. So then it causes headaches, so that's why I could actually have it, and it's just awful. But but I ended up being, this is surgery, septoplasty, yeah, septoplasty, that's it, yeah. Just couldn't pronounce it right, I don't think. But I talk about it through from hospital. I'll tell you about it now, because I went to the hospital on 31st of May, which is on Friday. Like, it was last week on Friday, and I went to a consultant with surgeon to see what it can do, if I need it doing, all that stuff. So when I got there, it was asking me general questions such as, can you breathe right? Is your headache still there? Does your nose run quite a bit? Stuff like that really. And then once he talked through all that, he actually had to have a look up my nose and have a look at my nostrils, if you can't see, but it's like that one's collapsed a bit. It's not as open. It should be like that. Or something, I don't know. But they had to get this probe. If you don't know what it means, I think it's probe anyway. It's like this long cable thing. I'd say that about big. It's quite big, but it was like quite thin, and it had a camera up, so they had to get it up both of my nostrils to see how it is, and if one of your noses is like bent like mine like that, they will go far up your nose, and it kills. They didn't even give me no numbing cream or anything, it proper killed. I did like 2 years ago, because I knew once I was 16 that I was actually going to get it, because they said, but they discharged me because I wasn't 18 at the time, and I've gone back since I'm 18, because the reason why they discharged me, because they said when you're 16 or younger, well, if you're under 18, I'd say, they can't do it because your nose is still growing. So they said if they did it when I was 16, it could end up worse, because if they did surgery, it could end up worse with it growing. So then I'm going to go through more operations, so they said just wait until you're 18. So I got back to once I was 18, which I was glad, and I actually had a consultant with him, and this is what they said. I'm not having rhinoplasty or anything, because they said it could make it worse, my nose, or I might not appreciate it, I'm not too sure. But I'm having septoplasty surgery, that's it. And what is septal surgery? It's when, it says on this actual leaflet, it's like when your nose, you can see your nose is like bent, and they'll straighten it out back, and it says here on this leaflet, the septum is the thin piece of cartilage and bones inside the nose. between the right and left side. It's about 7 centimeters long in adults, and some people this septum is bent into one or both sides of the nose, blocking it. Sometimes this is because of an injury of a nose, but sometimes it grows that way. We can operate to strengthen the septum. That's what it says, but it says here, why have septal surgery? If you have a blocked nose because of a bend or the septum, an operation would help. Sometimes we need to straighten out our bent septum, whatever, to give us room to the other things, such as sinus surgery. The operation is not meant to change the way your nose looks, but it might straighten my nose out so it won't look as bent. In some cases, a bent septum may cause with a twisted outside shape of the nose. In this case, septal surgery can be combined with nose reshaping surgery, septal rhinoplasty to straighten the nose, which I'm not going to get. How rude. And then it talk about all these other stuff. You can see it talks about the actual operation. It says the operation just takes about 30 to 45 minutes, where I will be asleep. Yeah. Where I'm juggling the needle. And then it just talks about packs. So when you have it done, you have to have packs and stuff up your nose, so because your nose can actually bleed. And this is what they said to me. If your nose bleeds after the surgery, I'll have to sleep at the hospital overnight. And they even said I could have a blood transfusion. Right. It says it doesn't hurt. It says not really, but sometimes in front of your nose can be a bit tender for a few weeks. But when you do after the surgery, as it says here, we give you some drops or spray to help this. It may take up to 3 months for your nose to settle down and for your breathing again. Try and stay away from dusty or smoky places. It says, what's that rustling? It says your nose will be blocked for both sides like a heavy cold for 10 to 14 days after the operation. So in other words, you're just gonna act like you've got a cold, but there's some risks anyway with it, and I'll tell you in a minute. Cause I don't think I'm having a good day. The dog, and now my camera, it just went off because apparently I've got no memory left. But as I'm talking about, I was looking at this form what I got given. It's patient bereavement, what it looks like. This is just a copy from the original one, what they gave to me. And that's what it is. When it stops popping back, it's upwind. It just talks about what I'm having, and then the benefits like improving nasal airway, but there are some risks, which is pain, bleeding, infection. Ooh. But if you do get infection, they'll just give you antibiotics. Septal formation, external deformity, and nasal packs. Apparently, I think it's that septal formation, whatever it says. I can't understand this doctor's writing. But they said if you have it done, there might be a hole in between your nose. I don't know. In your septum, where they've done it. Apparently there might be a hole. I don't understand what they meant by that. And then it just said any extra procedures which may come necessary during the procedure, blood transfusion. I don't want. So this is just a bereavement that is gave me the leaflet provided. And on about the general and original anaesthetic. Wind is doing my head in. And it was just about the doctor just signing. It was Mr. D.C. Simon. It's a specialty doctor. And it's just on about the patient. I had to sign it. If you've noticed, my handwriting is such a mess. I had to sign it. This wind is doing my head in. But that's about it. I will actually, if I even... He always barks. Toby, shut up now. If I've got enough description box, I could actually write about it in it, so people can actually see what it says in here. So it takes a time, but that's a bit. As long as people know, because some people might actually be going through it, and it's helping them out. And actually, that surgery I'm going through is actually hopefully in August, because I leave college soon and I've got like holidays. Like I've got a 2-week holiday coming soon, and then a week back, and then I'm off again, and it's just quite good. But I've put that for August, so that's only a day surgery. Yes. But they were discussing to me about this preoperative assessment, which you go in first before you actually have the surgery, and I'll explain why. What happens next after you've actually been to the hospital? Following your clinic appointment, you receive appointment for preoperative assessment. I don't really need to talk about the entrance. And it says preoperative assessment. Every patient listed for surgery needs to undergo preoperative assessment. This can take place either on the day of your clinic appointment or within a few weeks of provisional surgery date. Your provisional surgery date for the surgery will be given on the day of your clinic appointment, or a date surgery will be given when your preoperative assessment is completed. The assessment will be performed by an experienced nurse practitioner and will include medical assessments and a variety of tests depending on your operational fitness. This will include blood pressure, pulse, temperature, height, weight, BMI, urine tests, and MRSA swabs. The tests required may include blood tests, heart tests, ECG, and breathing tests. You will also have the opportunity to discuss your surgery, anaesthetic, and hospital stay. Please inform. Well, I don't think you really need to talk about when you have to inform if you can't do it, but it says here on the bottom in bold, if you can see, in bold. Your surgery cannot go ahead if you have not had a preoperative assessment. I think they just said that because you need to have tests and see how actually can cope with it, and I think stuff like that really. But once I find out when I'm actually having it done, the preoperative, I will actually do an update, because I don't know if anyone will see this. I don't care really, because it's only informing people who are actually going to go through it. So I thought I'll do it and gradually get into it and actually talk about what actually happens, and then you can see the before and after, if it actually changed. I don't know. And once I've had it done, I'll put an update on when I actually get back from the operation to see if I've got any bruising, anything else. Just keep it update really, but he's going to wait until August for the actual surgery, but I don't know when my preoperative is, so I will update with that. And if you've got any comments below, questions, if you've got any comments, questions, or anything else, just mail me or leave a comment below, and I will actually keep everyone updated to see what happens. But I will leave in the description box any of that leaflet you want, or the preoperative, anything what you really want, and the risks, stuff like that. I'll probably just short it down because I don't know if I could fit it all, but I've seen quite a few people actually fit it all in the description. They like put loads in the description on any